Thanks, Taylor. Monkeypox continues to spread across the country, including here in Maryland. And as of Friday, the CDC has been reporting 117 cases in our state. But how concerned should we be about the spread of this virus? Joining us live this morning with more is infectious disease physician at GBMC, Dr. Carol Cortez. Good morning. Thanks for joining us.
Good morning.
Talk about how contagious monkeypox is.
It is highly contagious, especially depending on the contact. It's a contact-mediated transmission that currently is happening.
You say contact. We've heard a lot of different ways that it can be the spread. And someone had even talked about, we'd done a news report about bedding. You could get it through bedding. Is that true?
Yeah, that is correct. So the contact implies intimate contact with a person. It also implies the transmission from lesions that are active to intact skin, as well as respiratory, as lesions can be also found in the mouth. So as they talk, it can produce aerosolize the virus and then inoculate in mucosas and also skin.
It's been compared a little bit to smallpox. So can you explain really what monkeypox is?
Yes, monkeypox is a serious disease and is transmitted by the virus or produced by the virus recognized as monkeypox. This virus, it belongs to the Poxviridae family, which includes vaccinia, smallpox, as well as monkeypox.
How? So go ahead.
No, I'm just going to say that although monkeypox has been named monkeypox, that does not mean that really is harbored in the monkeys only. It's not a reservoir. We don't know what the reservoir in nature is.
Right, because at one time there were only maybe 92 cases spread over 12 countries, and now here it is in Maryland. We have 117 cases. So how, you're talking about contact from person to person or bedding or that sort of thing, but does it come from animals?
Initially, that was the case. However, right now we see contact person to person. This is a new event. It has happened in the past, but now is an outbreak, meaning that is facilitated by contact person to person. We're not exactly sure how this started out, but initial epidemiological data suggests that it came from Nigeria, as the clade has been related to the Nigerian strain recognized a few years ago. So as it is now, there are two clades of monkeypox that are recognized. One is the Central African, and the other one is the West African. The current outbreak is more related to the West African, which typically is less serious, less complications occur, and it's been not related to human transmission. That is more characteristic of the Central African clade. However, right now, the outbreak has behaved differently from the typical disease described initially. So, and the human-to-human transmission has been noted. And when human-to-human transmission occurs, especially with contact, and especially in this outbreak, the prodrome, which is fever, malaise, and can be contagious, the disease can be contagious at that time, it seems to be not present in many cases. So therefore, you can be, the delay can happen. And although sometimes the prodrome may be a little bit blunted, still a person can be contagious at that time. So that's one of the reasons.
So I want to talk a little bit about these vaccines that are available now in Maryland and where they're going to, and also talk a little bit about, there's been a lot of confusion. There's been some myths. Can you separate the myths from the facts that this has anything to do with the LGBTQ community?
The LGBTQ community is not solely affected by this infection and disease. Although there has been recognized initially in this population that by any means that only this population is at risk. So the transmission, as I said, is human to human by intimate contact, but also through lesions that are active. Bedding, because this crossed, and these lesions can cross and aerosolize. So therefore, touching the secretion, touching the bandages that are covered in these lesions can be a source of transmission, a source of the infection being from one person to the other being transmitted. So this population shouldn't be the solely concern. Humans of any kind, even children, even recently has been identified in babies. So as you see, then it's not only the LGBTQ community. That is a myth, but initially used as a epidemiological criteria. That
Yeah,
is
thank
why.
you for clearing that up. And just one more quick question, and then we have to go, unfortunately. How concerned should we be about this?
It should be concerning, especially when a rash that is serotypical for monkeypox is recognized. Currently, this disease has been presented also simultaneously with other infections, such as chickenpox. It can be presented co-infected patients. The other thing is that it has been, because of the difference in the behavior of the disease, it has been seen as only lesions only recognized in the perineal and the genital area. So when a physician sees lesions like that, epidemiological criteria are met, which are a person that has been in contact with another person
Right.
recognized to have the disease, when they are coming from or visiting a country that is endemic for monkeypox, or in any community that has activity for monkeypox. That is one of the criteria to be concerned about.
Okay, well, we'll be definitely checking back in with you for sure as this situation does continue. So nice to have you on our show this morning. Thank you for joining us.
Thank you for having me.
You're so welcome, and stay with us. We'll be right back.